Are you worried about high ketone levels and how they impact your diabetes management? First, ensure you have a clean, dry container ready for urine collection and thoroughly wash your hands to avoid contaminating the sample or the test strip. Next, collect a urine sample in the clean container. You don't need a full cup, just enough to submerge the test pad of the ketone strip. Now, carefully remove one CVS Health ketone strip from the bottle, immediately resealing the container to protect the remaining strips from moisture. Dip the test pad end of the strip completely into the urine sample, making sure all the reactive areas are submerged, and remove it quickly. Gently tap the side of the strip against the container to remove any excess urine. This prevents inaccurate readings due to dilution. Now, wait precisely the amount of time specified on the CVS Health ketone strips packaging, usually around 15 seconds. It's crucial to time this accurately for reliable results. After the waiting period, compare the color of the test pad on the strip to the color chart provided on the CVS Health ketone strips bottle. Match the color on your strip to the closest color on the chart to determine your ketone level, ranging from trace amounts to high levels. Record your ketone level reading, along with the date and time, in a logbook or app to track trends and share with your healthcare provider. If you consistently have moderate or high ketone levels, immediately contact your doctor or healthcare professional for guidance on adjusting your diabetes management plan and preventing ketoacidosis. That's how you use CVS Health ketone strips to stay on top of your health.